of Russian and East European Studies. I'm going to give the floor to him now to talk a little bit about his own research maybe, and introduce himself and our speakers. So good luck to everybody, and thank you for joining us.
Thank you, Leyla, and welcome everyone to this seminar in the series on Azerbaijan, which the Oxford Nizami Ganjavi Centre and the Oxford School for Global and Area Studies have assembled. It's fairly unprecedented, I think, to have such a rich array of speakers and experts talking to us about Azerbaijan in particular. And so we're very excited about this. And unfortunately, Chris couldn't be with us today to convene this seminar. So I've stepped in, and I'm a social historian of Russia and the Soviet Union, which means I care about Azerbaijan and the other former Soviet republics, of course. So today's session is called Child Wellbeing and Child Savings Accounts in Azerbaijan, Theory and Possible Policy Design. And we have two speakers to talk to us about this theme. They're each going to present for about 20 minutes or so, and there'll be plenty of time for Q&A afterwards. So I'll introduce them in the order that they're going to speak. Leyla Karimli is an assistant professor at the Social Welfare Department at UCLA's Luskin School of Public Affairs. Dr. Karimli is an interdisciplinary scholar of social development. Her research examines the multiple social dimensions of child poverty and social exclusion, and seeks solutions at both the program and policy levels to reduce child poverty. Dr. Karimli uses experimental and quasi-experimental quantitative studies to examine complex links between the economic dimensions of poverty, social norms, social support mechanisms, and psychosocial outcomes in order to inform programs and policies to alleviate child poverty in the context of sub-Saharan Africa and Central Asia. So Dr. Karimli will speak first, and then I will introduce our second speaker, Aytakin Huseynli. So, Dr. Karimli, the floor is yours.
Thank you. Actually, we will interchange. I will speak, and then Aytakin will speak, and then I will go back. So, would you like to present Aytakin first, and then we will start our presentation? What do you think?
Right. Okay, so I'll just introduce Aytakin then. Aytakin Huseynli is a PhD candidate and adjunct faculty at the Brown School of Social Work and Public Health of Washington University. Trained in quantitative and qualitative research, she's specializing in child well-being with a focus on evidence-based interventions. She is specifically interested in studying institutional and structural barriers in child well-being and child maltreatment. Her mixed method dissertation research examines the effect of the resource curse on child well-being in low to middle income gas and oil rich countries. She is the founder and board member of the National Association of Social Workers in Azerbaijan. She is a research expert of UNICEF and member of the editorial boards of the peer-reviewed journals such as International Social Work, Journal of the School of Social Work, and Global Social Welfare. So I'm inviting Aytakin to speak first.
All right, I'll start.
Dr. Dan, we designed it the way that Leyla will start, and then I will follow her. Okay, Leyla, go ahead.
Thank you so much for introduction, Dr. Healy. Hi, everyone. Hello, Leyla. Hello, everyone. I'm very privileged to be presenting here at this series. Thank you for having me. And I love that I have this opportunity to co-present with soon-to-be Dr. Aytakin Huseynli. So it is an absolute privilege. And let me start sharing my screen. Wish me good luck with that. Share.
Great.
Right, do you see my screen?
Yes, very well.
Ta-da! All right, so that bit worked. All right, so this is what we will be doing today with Aytakin. We were told that we have about 45, 50 minutes, and this is what we are suggesting to do. I will present the idea of child savings accounts, talk briefly and generally about what are child savings accounts, what is the theoretical framework behind this policy mechanism, what does theory claim in terms of child savings accounts having an effect on a range of outcomes, and what are specific design elements of those child savings accounts. And then floor will be Aytakin's, and she will present preliminary findings and policy recommendations derived from her fieldwork in Azerbaijan. So she will talk about the feasibility and policy recommendations related to introducing possibly child savings accounts in Azerbaijan. And then I will follow up by presenting some general empirical evidence to understand what do we know in terms of empirical evidence behind the theoretical claims, right? What do we know about potential effect of this child savings accounts on child poverty, on improved education, on child mental health, psychosocial outcomes, and so on. All right. So slide number 2. All right. So what are the child savings accounts? Basically, these are savings accounts that are open on in a child's name with a mainstream financial institution, banks, right, with a specific purpose and with specific mechanisms attached to it. But before I talk about those specific mechanisms, I would like to cover some brief theoretical background about this policy mechanism because I love theory and because I truly believe that it will help us better understand the phenomenon that we're debating here. So child savings accounts are a policy intervention mechanism that is based on asset-based approach to welfare. Right? So the main purpose of asset-based approach to welfare is not just to address income gaps and satisfaction of consumption needs. This is done by income maintenance welfare policies. But asset-based approach aims to address a broader picture and aims to address limited opportunities that impede an individual from advancing economically, socially, psychologically, beyond satisfaction of consumption needs. Right? So those of you who are familiar with Amartya Sen's capability approach, I'm sure you can see the strong influence of that approach on the asset-based theory in this framework. So Amartya Sen's capability approach, just a brief reminder, is it emphasizes the importance of capabilities to attain what an individual has reasons to attain, and capability approach defines poverty in terms of limited capabilities, not just limited monetary or financial resources. So, and as you see, asset-based approach, it adopts the integrated approach to building, to human development, to developing human capital, social capital, and economic capital. So, all right, claims. So it is claimed, the theory claims that asset accumulation may have important benefits, not just economic benefits, but important developmental, psychological, and social benefits. And the theory claims that assets and asset accumulation process generates effects, economic, social, psychological effects, independently from income. Now, some scholars debate this argument and they call for a distinction between instrumental effects and what they call intrinsic effects, instrumental effects of assets, that is the opportunity that comes with asset ownership, right? So basically the question is what wealth allows us to do versus intrinsic effects. And this is what asset-based theoretical framework seems to claim, that assets have intrinsic effects. So this is the effects that can be achieved only by asset ownership. Right. So basically here the question is what assets do to the individuals rather than what assets can do for individuals. Also, another interesting theoretical distinction that again is suggested by some scholars is the distinction between existential effect and social identity effect of assets. So existential effect is the way in which asset ownership might transform an individual's sense of self, right? Their place in the world, their sense of self, irrespective of how others perceive them. And the social identity effect is the effect that asset ownership could potentially have on our perceptions of social acceptance or the way how others regard us. Now, what is important to note, and this is one of the arguments that is used by proponents of asset-based approach, is that building assets is not just about buffering economic hardships. So it's not just about reducing vulnerability to shocks. And assets produce not only economic effects, such as, for example, enhanced economic stability, increased home ownership, improved income generation opportunities, intergenerational transfer of wealth. But so not just that, although one thing that is important to mention that asset-based approach, particularly the type of mechanism that we are discussing today, child savings accounts and individual development accounts, they certainly connect people to mainstream financial institutions. But it's also about changing people's behaviors and attitudes. At least that's what's claimed by theory. So assets may potentially change people's behavior and attitudes in such a way that people have higher self-esteem, greater future orientation, higher expectations regarding their children's education, and also they may feel more empowered and having a greater control over their life and more confident about their future. So institutional theory, and one of the, I have to step back and just mention Dr. Michael Sheridan, who is seen as founding father of this approach, and is also the author of the institutional theory of saving, and child savings accounts and individual development accounts are based on his proposed theory. So this is from the institutional theory of saving perspective. Low savings and low rates of asset accumulation among low income and poor people living in poverty. It's not explained by low level of education, but mostly by lack of, and other factors, restricted financial resources and so on, but mainly by lack of individuals' access to institutional constructs that encourage savings. So basically the argument here is people who live in poverty can save, and they do save if they are offered specific institutional support. Key institutional constructs encouraging individual savings, according to Professor Sheridan's theoretical framework, is access. We're talking here about proximity of saving programs, making it accessible, making banks accessible, making the savings mechanisms accessible. So not just proximity, but also perhaps using electronic deposits. The second individual construct is incentives. They come in the form of matching deposits, and I will talk about it a little bit more, and Aytakin will provide very detailed insight on that. So incentives matching and perhaps earnings on savings. The third construct is information, which is educational programs to increase economic literacy, financial literacy, and so on. A fourth construct is facilitating the process by providing assistance from programs or by using automatic deposits. Another construct is setting specific saving goals and setting expectations. Then restrictions, which is using assets only for authorized purposes. Right, so there is a set of restrictions on withdrawing the money from the savings accounts and only for authorized purposes, and those purposes can differ depending on the aim of this mechanism. In our case, it would mostly be education because it's child savings accounts. In some other cases, it could be home ownership, it could be investing into small enterprise and so on. And finally, it's the security of investments. And one more slide before I give a floor to Aytakin. So specific mechanisms in child savings accounts, and Aytakin will touch upon each of them in application to specific context of Azerbaijan. So specific mechanisms of this child savings accounts are seeding money, which is pretty much covering the costs of opening a bank account and also depositing the initial amount. So the conversation about matching deposits, what should be the matching rate? So what is the matching? It's, let's say you have a child saving account and you're depositing £1, $1, 1 manat, right? And government or whichever agency is managing this, they are matching your deposit on a range of rates. Now, rates could be one to one, which is government is depositing £1 to match your £1. So as a result, child has £2. It could be 3 to 1, which is you're depositing 1 manat, and then the government is matching it with 3 manats, and as a result, child has 4 manats. So that's matching, and that is a part of incentivizing people to save. Capping matches, the policy conversation should be about what is the maximum amount that government or whichever agency is managing it. What is the maximum amount that they can match? What are the withdrawal restrictions? What specific purposes this money can be taken for from the account? And how to provide financial training and social support to participants. Social support in the form of counseling, in the form of reminders, encouragement to make regular contributions. So this is very general introduction to the idea of child savings accounts. What's the theory behind it? What are the specific components of child savings accounts to look into when we discuss specific policy application in a specific country? In our case, it's Azerbaijan. And now Aytakin will share her wonderful findings and her fieldwork in Azerbaijan. Aytakin, over to you.
Thank you very much, Leyla. You kind of made so great introduction. Now I have this huge responsibility, and let's see if it is wonderful or not. So I will let the audience to judge it. So hi everyone, I am Aytakin Huseynli, and after Leyla's great description of child development accounts and importance of it in child well-being, I would like to introduce our just possible recommendations, what propositions I would say for possible policy design for child development accounts in Azerbaijan. These are just propositions, recommendations, but each of them need to be discussed debated in detail with policymakers in Azerbaijan. So I will share my screen right now and start my presentation. Okay. Okay, one more time. I'm Aytakin, representing Center for Social Development at Washington University, and my other co-authors for this policy paper is Dr. Michael Shiradin, who is the founding father of ACID, Importance Assets in Lifting People Out of Poverty, and Daniel Gottlieb. Daniel was mastermind of the National Policy of Child Development Account in Israel. He works for National Insurance Institute of Israel, also professor at Hebrew University. Our recommendations based on three aspects. First one is findings of the needs assessment, which we, with Dr. Michael Shiradin and myself, visited Azerbaijan in 2017 and in 2018 to do some preliminary assessment of needs and kind of see the possibility of the design in Azerbaijan. In addition to needs assessment, we also took 10 key policy design, which suggested by Shiradin and his colleagues, which Leyla briefly overviewed them. In addition, all to this, we also looked at designs of national child development account policies, which are implemented as a national public policy in countries such in a couple countries on the earth. The paper which I am presenting today is was published as a brief research brief on January 2020, and you can have access if you want to have detailed information from this link. And the paper, it's under review right now. We will share it as soon as it's published. So since today's panel is called Child Wellbeing and Child Development Accounts Importance in Achieving it, I just want to give a brief description of the definition of child well-being, what we as a researcher, the authors of the paper, how we see child well-being, and my co-presenter as Leyla, how we see child well-being. Literature has many definitions of child well-being. Scholars in child well-being, when they define it, they base their definition on a couple concepts such as child development, child rights, today's conditions of children. People are interested about today's situation of children. Some are future-oriented, and some also use children's own perception to define the child well-being, or some of them are use both of these concepts, right? Child rights, present conditions. So here are the main selected main scholars who define child well-being in this field. But I, as a researcher, and my colleagues, we use the definition by UNICEF, which is multiple overlapping deprivation analysis, which is called MODA, and it views child well-being from several from several perspectives, such as nutrition, education, health, sanitation, protection, access to water, and protection from all kind of violence, from all kind of child maltreatment, and also availability of monetary resources. So child development accounts concept overlaps with providing children with monetary resources, and in our case, in our policy case, access to education. Okay. So when we visited Azerbaijan in 2018 and 17, we did about 24 interviews with key informants in child well-being and social protection. In addition to interviews, we, with Dr. Michael Shiradin and with his center, we organized two conferences. One was very local in 2017, and second one was international with participation on 12 countries. And who we interviewed in addition to conference, our key informants were ministers, deputy ministers, heads of department, member of the national parliament, UNICEF, World Bank, universities, USAID, of course, and national non-profit organizations. So we interested what they think about this idea and how they see this idea can be realized within coming years in Azerbaijan. So basically, we used purposive sampling strategy to select our key informants, and we did in-depth interviews, and we used framework method for analyzing of our data to have structured outcomes for our policy paper. We coded, several themes came up, but here are the themes which were relevant for our purpose of visit, relevant for our needs assessment goal. We found that findings show that people welcomed the idea very warmly. So there was acceptance of the child development accounts idea. Kind of policymakers thought that it is a very good idea in compared to other policies which were suggested before. There was expression of willingness to have child development accounts in coming years, maybe not in 2-3 years when we did it back in 2018, but within a decade, they said that it might be possible. So it was just expression of willingness that if it is possible, Azerbaijan can do that. It leads to our next finding that there was a lot of couple times mentioning of the oil and gas wells, that Azerbaijan stands out in the region because of its oil and gas wells. That's why it makes Azerbaijan to kind of think the possibility of this idea and as a national policy. And also, we also find out that there are current financial resources within child well-being system, which were designed, implemented during Soviet time, but it doesn't have efficient way of affecting children anymore. So those resources can be geared here. This is one resource is, that post-Soviet countries still have large public residential institutions for raising abandoned and social orphans, and in the whole region is in the process of getting rid of those institutions and using that available resources for the more child-friendly policies. So some resources, our colleagues from Minister of Finance mentioned about that some resources might come from that resources to if this policy is being discussed in the future. We also found out that in order to have CDAs in Azerbaijan, there needs a strong institutional base. Our participants talked a lot about trusting in public institutions if we wanted to have child development accounts. So if they are opened and run by public institutions, let's say ministries or government agencies, families will trust their dollars. So families will put their dollars in these accounts. And we also, during this conversation interviews, we found out that there is private financial institutions are still weak, and they still are in the process of strengthening themselves. And our participants also mentioned that if these accounts are opened by public institutions, people wouldn't trust to have accounts in this organization. We also found out that Azerbaijan, like many post-Soviet countries, still doesn't have asset management institutions and vehicles. There is few, but they're not enough to have national policy for CDA, managing for this, delivering these accounts. So in addition findings, as Leyla also mentioned, I briefly go over 10 key policy design elements, which we took as a guidelines. These are universal eligibility, automatic enrollment, starting at birth, automatic initial deposit, automatic progressive subsidy, a centralized savings plan, investment growth potential, targeted investment options. This is very also important. Restricted withdrawals, means tested public benefit exclusion. These are key policy we incorporated on paper, which I'll go in detail. And also we looked at the experience of Canada, United Kingdom, Singapore, Israel, and the couple states in the United States. I won't say that that policy stopped in United Kingdom in 2011. It was universal, covered everyone, and it was progressive, means that encouraging low-income families to save more. So first, we want Azerbaijan to have it a universal. Universal will cover all children, no children will leave behind. And having social policies for children to eliminate poverty among them globally is one of the targets of United Nations Sustainable Development Goals. So Azerbaijan, by having it universal, will meet that goal, global goal as well. In addition, research shows that universal policies are able to eliminate poverty among children in low to middle income countries. Specific research done in Azerbaijan by researchers showed that Azerbaijan had a universal child allowance policy. It stopped in 2006, unfortunately. That policy was effective in reducing poverty among Azerbaijani children. Second, we want it to be automatic. Automatic policy will enroll every newborn child. So in Canada, for instance, although it is a universal policy, it is not automatic. That's why enrollment rate is not more than 50 or 52%. But in Israel, it is automatic. Children are enrolled automatically unless parents opt out to not to continue due to their religious beliefs. So for Azerbaijan, we suggest the same automatic enrollment at birth. Same is in Maine. Children in state of Maine, America, they are automatically enrolled. Assets in CDAs, we want them reserved for post-secondary education. With basically countries around the world, such as Israel, such as in United Kingdom when it was active, in South Korea, they don't have purpose. Like accounts are just opened, just encourage families to create saving behaviors. But for Azerbaijan, in Canada, it is reserved for post-secondary education. And in Singapore is the same. And we suggest same thing for Azerbaijan. And in addition to these successful experiences, there are a couple of reasons why post-secondary education. First, country's overall development strategy, which kind of promoted by the leader of the country, highlights the human capital development among young people and children. Second, child marriages. About 11% of our children in Azerbaijan are facing child marriages. And global research showed that education is one of the predictors of child marriages. As long as children stay in school or continue their education, they delay marriage. And Azerbaijan qualitative study done by UNICEF back in 2011 showed that one of the reasons of child marriages in Azerbaijan is lack of financial resources for families to care for them, to send them to school. So we believe that if it is linked to post-secondary education, it might help in reducing child marriage as well. Another reason, in 2018, about 7,000 young people couldn't continue their education in Azerbaijan due to lack of payment for educational fee and living expenses. This statistics was given by one political party we have, REAL. So that's why post-secondary education will help children to achieve their well-being in couple dimensions. Automatic initial deposit, we suggest that this comes from the already existing money, which is called baby bonus. This is the national baby bonus is given for every children when they are born. It is in amount of $120. We suggest that half of this money comes automatically to open accounts. This kind of experience in Israel. Israel automatically invests half of the child allowance, monthly child allowance, to the account of the children. So Azerbaijan can refer to this experience, but this baby bonus is one time. Singapore does the same. In Singapore, there is an automatic seed money for CDAs as soon as accounts are opened. Incentives in the form of 101 or 3-to-1 matching design. We suggest Azerbaijan having a basic design 101, as Leyla explained. Government gives one, families put one. For low income and low to middle income families, in addition to 101 design, we suggest doing 3-to-1, which means that government puts 3, families put 1. This is to low to middle income countries. It is experienced. It is called also progressive subsidy. It is experienced in Canada, and it also is experienced in United Kingdom when its policy was active, and in Singapore as well. In Canada, in addition to 101, the federal government has 2 more grants for low to middle income countries. In addition to this, some provinces such as Saskatchewan and Calgary, where the oil, you guys have oil, those provinces also also give more grants for their residents. So Azerbaijan can refer to the experience of Canada and Singapore, but there needs to be a lifetime cap that government families also know that there is a limit by government. For Canada, lifetime cap was 7,200. Ongoing deposits by government, we suggest that Azerbaijan can use dividends from oil and gas wells to support these accounts, put ongoing money to accounts of children. For this, Azerbaijan can refer to the experience of the United States, state of Alaska, and Canadian province of Alberta, where local residents get lump sum annual dividends from the provincial government as they live in their land where oil is exploited, is used. Centralized saving plans. For Azerbaijan, we suggest that. What does it mean? It is a platform where accounts are open and run by a single entity. This experience is not unusual for Azerbaijan. Azerbaijan has similar experience. Central, basically most government policies or benefits are central. So it can, like disability pensions, like general pensions, other social aids. So Azerbaijan can use the same form, same experience for these accounts. For that, we are suggesting that accounts are opened either by the state social protection fund, state oil fund, or the central bank. In one of these can open and run the account, and it will also answer the concern of the population about the trust issue. As I mentioned earlier, one of our findings show that people wouldn't trust private entities if they are going to run it. Yes, accounts will not be investment or interest earning. They will not bring more money, but they will be safe, they will be safe and sustainable for a long run for now, until Azerbaijan has this private banking system, strong banking system in place. In the future, it can be changed to other countries' experiences. Management of finances. We are suggesting that since accounts will be linked to post-secondary education, no one has access to accumulated assets. Children, parents, or whoever investing in money. So we suggest that when accounts grow, when there is a time for withdraw money, as accumulated finances is transferred to post-secondary education upon submission of the acceptance letter. For instance, since they are open for post-secondary education, when owner of account must submit a submission letter or some kind of paper about the fees in addition tuition fee, for instance, living expenses, buying books, and other education-related expenses. Upon the submission of the letter request, it is directly transferred to that entity. It will help to avoid errors and leakages for undesired expenses. Administration and delivery. We again suggest, as I mentioned earlier, that these accounts are administered and for some time delivered by government agencies such as Social Protection Fund, Central Bank, the Oil Fund of Azerbaijan. It is in Canada, Singapore, Israel, and South Korea. All these accounts are administered by the government agencies such as ministries and departments of social protection. Online banking and information and access. This is also one of the key elements, institutional elements in policy design by Sheridan, that families or account owners have access, they have information of what's happening in their accounts. So for Azerbaijan, we suggest that the e-banking system for child development accounts, that Ministry of Communications and High Technologies, Azerbaijan even can develop a specific application, but with very limited operations, such as the owner of the accounts can only check the balance, only deposit money, and that's it. So limited function that they cannot withdraw money or transfer money somewhere else. Also incorporating informational communication technologies into socio-economic interventions is one of the UN's recommendations for eradicating poverty. So Azerbaijan will also meet by that goal from that end. And finally, we are suggesting having financial education aspects of CDAs, as financial education is very important in managing financing and planning for the future. We suggest that for children, it is included in secondary school curriculum. We have this livelihood skill class in secondary school, so it can be included to that curriculum and taught to children. For adults, well, this paper was written before COVID in 2019. So then we were suggesting online and offline delivery for adults and maybe children. It will help. Online option would help. We then suggested that couple groups, cover couple groups who are not able to travel to training destinations, such as people with disabilities or parents who are taking care of children, are not able to leave home quite often. It will also help in rural areas, that people sitting in rural areas can have access to this education. In Azerbaijan, everyone has access to mobile phone. So usage of mobile phone and internet is very high in Azerbaijan. It's over 80% of the nation population have access to internet through mobile phone. So we thought that online access and COVID, it's happened that now during the COVID, everyone is using online platforms for educating themselves. We also suggested that mobile phones, like text messaging system, would also use to deliver financial knowledge, like brief messages about financial education, financial knowledge, saving tips about the savings. Receiving promotional text messages to the phone is wide experience in Azerbaijan. So you can get spam promotional messages to your phone. So I suggest that Azerbaijan use that experience for financial education of the account owners as well. That's all. This is what we suggest for possible policy design Azerbaijan. Thank you very much. I think I did within 20 minutes or 21 minutes. Okay, I stop sharing my screen. Leyla, floor is yours again.
Thank you. Thank you so much, Aytakin. It's a fascinating presentation and a lot of very valuable information about specific context in Azerbaijan. It's very rare to have this amount of and breadth of knowledge. So this is absolutely fantastic. Now, I don't mean to be spoiling a very shiny and promising picture of assets and savings accounts that we just generated through this, through the first part of our presentation and through the theory. But let's look into what does evidence tell us, empirical evidence. So I'm a quantitative researcher and I trust in numbers. And if policymakers in Azerbaijan have this wild idea of discussing this policy with researchers prior to implementing it, I would love to share some possibly doubts and inconclusive evidence that we have empirically about the claims made by theory. So first of all, I'm on the wrong slide. All right. First of all, breaking news. No child savings programs, no universal child savings programs cohort has yet reached young adulthood, and therefore pretty much no data is available about universal child savings programs' impact anywhere. So it's due to known reasons, right? So the cohort hasn't reached the graduation yet, and therefore we are unable to truly robustly understand the full impact. This being said, however, some elements of child savings accounts have been evaluated, but most of the existing studies, they focus mainly on asset buildings for adults, right? So for example, retirement saving programs and so on. So But it's important to keep in mind that saving goals are different. Adult saving programs, they promote saving for different purposes, for retirement, for home ownership, for small businesses. But the child savings account's main purpose is education. So the goals are different, and therefore the potential effect could be different. But also very important to keep in mind that those who save in adult saving programs are those who eventually benefit from those savings. Right? Whereas in child savings accounts, children are beneficiaries, but those who save are not necessarily children. It's their caregivers, their parents, their relatives, their friends, and so on and so forth. Sometimes it could be children too, but predominantly it's not them. Now, critical question. Critical economic, perhaps, question, and I would love to have a conversation with economists here, is whether asset building programs indeed help people save more than they would have saved otherwise. Basically, the question is, do we need this intervention to help people save, or they would have saved anyways without this intervention? Knowledge and existing evidence is yet to reach the consensus on that matter. So we have not yet reached the consensus of whether asset building programs increase savings or the effect is very marginal, if any. The inconclusive evidence on increased asset holdings is partially because the variation, the effect varies by the asset type, right? So some assets may increase, some assets may not across different programs. But I would want to draw your attention to methodological challenge in evaluating these programs, and the methodological challenge that we see in existing evaluations. Most of them rely on either observational data collected from program participants, and this is the case of evaluations of child savings accounts in United Kingdom. So there were a couple of studies, but most of them rely on observational data collected from program participants. So pretty much have no control group. So and having no control group, we can't really make robust inferences. In some cases where we do have experimental design, for example, I had the privilege of evaluating one of those experimental designs in Uganda with Professor Siwamala. But even in that case, we did have treatment and control groups, but administrative data on savings was available only for the treatment group. So I had to rely on self-reported data on savings, which is a significant challenge. And other methodological biases that are mentioned in evaluations are selection bias due to specific methodology how participants are recruited, naturally very little causal claims due to specifics of research design, and lack of longitudinal evaluations. Also an important economic question, a conceptual question, is when we see the increased assets, so people have the savings accounts and they save. Do they save new money? Or are they reshuffling assets from one account to another? So this is important to understand because this is one of the key mechanisms. The whole reason why we are suggesting savings accounts is we believe that people will save. Now the question is, are they really saving, or they're simply reshuffling from existing savings? And this is we still have to reach consensus on that. By the way, I have to mention something, and we probably will talk, I hope that we will discuss this more in Q&A session, but there is no conclusive evidence that higher match rates increase savings. So whether you're matching 1-on-1 or 3-to-1, there is no conclusive evidence that 3-to-1 is better than 1-on-1 in terms of increasing savings. Some studies show increased savings, some others show negative effect or no effect. So even here, the evidence is inconclusive, and there are some studies, specifically one by Richardson Thayer, even though it's 10 years old, it was a systematic literature review where they look into results, and they come to the conclusion that effect of this intervention on poverty reduction is inconclusive at best. In my own studies, I was looking into child poverty, very naive measures of child poverty, unfortunately, in this particular study, but nevertheless. And I was looking into household wealth measured through the DHA Demographic Health Survey Wealth Index. And my own research also shows that we really don't have any conclusive evidence that offering child savings accounts to families indeed help reducing poverty. It could be because of the reason why we can't find this conclusive evidence could be because we don't really have enough of a longitudinal data. It could be because of the conceptual issues, income effect or substitution effect, but I will not go there because we are already running short of time. Let me talk about educational outcomes and mental health outcomes real brief. So there is an evidence that child savings accounts generate positive, have a significant positive effect on educational outcomes, and you see the range of those outcomes here. That includes not just the performance and attendance, but also high school, college graduation, possibility of college attendance, and so on. Now, in terms of discussing the specific policy, including specific policy in Azerbaijan, I would really love to draw attention to variation of this effect by children's age. Right. So, for example, some studies show that the association was significant for children age 11, 14, and it was not significant for children 15, 17 years. So knowing this variation might help fine-tune the policy mechanism to make sure that it serves those who need it. And also another interesting conversation, which I hope we will have in Q&A, is how exactly having child saving accounts improves educational outcome is not necessarily known. There are some suggestions that it could be because of changes in caregivers' behavior. It could be because of increased expectations about education, but it's not necessarily conclusive. And finally, we do have an evidence about improved mental health and psychosocial outcomes for both children and their caregivers, effect as a result of being offered and participating in the child savings accounts. But again, similar to educational outcomes, we don't really have conclusive evidence about what are the specific pathways. How exactly, what is the specific mechanism? How exactly having a child savings account improves mental health and reduces the depression and improves the hopelessness and so on. So I was trying to run some of the analysis to understand, is it because of savings or it's because of something else in the intervention that they were receiving? And again, acknowledging limitations that I had a rather small sample size. It was a particular study, but I found no effect of that savings did not serve as a mechanism through which this intervention affected the psychosocial outcomes. But there's certainly a room for more research and for more debates about that. And I truly hope that in case if policymakers in Azerbaijan, if they decide to seriously consider introducing child savings accounts in the country, I truly hope that prior to launching it, some pilot study with a proper, robust research design will be introduced so we can actually understand the specifics of the context in Azerbaijan prior to launching the large-scale policy intervention. And there is a lot of questions. I'll stop here because I think we're running out of time. I'll stop here to have more space for Q&A, and I look forward to having a more detailed conversation here. I think I should stop sharing my screen. Did it work? Yeah. Thank you. Thank you, Dr. Healy. Thank you, everyone.
Thank you. Thank you, Leyla and Aytakin, for these two, these interlinked conversational presentations about this really important issue, I think, of alleviating child poverty and this really interesting mechanism for doing that. I'm waiting for questions to appear in the Q&A box. So just to remind people that if you have questions, you'll find a Q&A button at the bottom of your screen. And if you hit that button, you'll come up with a box and you can type in your questions. So please do that and we'll monitor those and put them to our guest today. I want to kick things off, first of all, by a question that struck me, and this comes out of some of the previous seminars that we've held in this series, where there were some expressions of a lack of trust in public institutions, and I was very struck by, I'm not sure whether this was aspirational, theoretical, or whether this was existing experience in Azerbaijan, and I hope you'll be able to comment on that. But your respondents seemed to bank on and had, high levels of trust in public institutions, and they had less trust or faith in private banking institutions. So, just to sort of show the sort of global end of this, I noticed that in the UK, when the government ended this scheme in 2011, what they replaced it with were commercial savings accounts for children, the junior ISA, it's called. So a tax-protected wrapper for children's accounts, but in private hands, as you might expect in the United Kingdom. Where we love private capital. So my question is really, what is it about that, this particular mechanism or this particular enterprise that leads you to focus on trust in public institutions rather than private ones? Is it something about the banking environment in Azerbaijan? Is it something about the fact that it's welfare policy led? Speak a little bit about that for us, please. Oh, Aytakin, I think you're muted.
Okay, I'm muted, Dr. Dan. I will comment it. Then Leyla might have her opinion. Actually, we found when we're talking, there is a high trust to public institutions like ministries. People, if something comes from ministries or if something is done by government agencies, people more high probably go with it, let's trust with it, rather than it is from private banking system. And actually, we were in a time when a couple months ago, actually, one bank was bankrupted. So, our findings also time sensitive. So we were around the time, a couple months ago, there was a big bank, I think it was, but it was a private bank bankrupted. And this happens a lot in Azerbaijan, couple banks closed down, bankrupt. So maybe that's our findings that's time sensitive for that fact. But generally coming from centralized government kind of a governance system, like USSR, everything was centralized. There was not private entity at all. People still have this mentality. If it is a public institution, it is changing time by time as private institutions prove themselves to be reliable. It will change, but coming from this background, I think people generation which we were having in meetings, generations. Policymakers, they have this still approach, if they have to choose between public and private, probably they would choose public. So it reflects itself on financial institution as well. So of course, public institutions stands out more in terms of having trust of people. In addition, you mentioned about United Kingdom. When the policy was active there, researchers state that one of the reasons why policy stopped, in addition to austerity measures, and another thing was that the policy CDAs didn't have the purpose. So it was just basically families were encouraged to save. It was progressive. For instance, in addition to basic SHIM, government was giving additional money to low-income families and plus additional money to children with disabilities. But the accounts didn't have any purpose. So the owners of the account could use money to anything they want. This was another reason, according to research, in many other factors. One of the reasons that why we are giving money to people to save for what. So So this is Leyla. Go ahead if you have any comments about public or private institutional trust.
Okay. I think part of this conversation needs to go back to the previous webinar, which I had a privilege of attending as a participant, where Dr. Faris Huseynov and Dr. Elvin Efendi, they were presenting, and they were talking about the private sector development in Azerbaijan, and those are two economists, and they were presenting from the point of view of economists. And if I remember it correctly, I was actually in between airport and plane listening to it. If I remember it correctly, they also spoke a little bit about trust in terms of private sector development in Azerbaijan, and they raised that issue about not very high trust. But I believe in their case, it was not the trust on behalf of constituency towards private sector institutions. It was the trust between private sector institutions and public sector institutions. Now, if I have to talk about trust in Azerbaijan, first of all, I would look into any data that I have. I'm post-positivist researcher, I believe. So I would look into data. Now, when I look into data, there was a Caucasus Resource Center, which was a think tank collecting, national representative data in all three countries in South Caucasus, Azerbaijan, Armenia, and Georgia, and each had their own country offices, and so they were collecting data in Azerbaijan, and part of that data was trust towards government. Now, as Aytakin was speaking, I tried to quickly see if I can look into that data, and unfortunately, I see only the data from 2013, and it shows that first of all, trust varies depending on what branch of government we're talking about. Are we talking about parliament, president, or general government? And so we also show that trust to parliament is rather low. So it's 41% versus trust to general government 60% or 50%, and trust to president is 77%, 60%. Now, probably one of the biggest methodological questions in measuring trust in Azerbaijan would be the possibility of high risk of social desirability bias in responses to the trust questions, right? So this is precisely why I strongly believe that prior to launching child savings accounts as a full scope policy intervention, we do need to do pilot testing, because we will see how much people trust through their actions, not by asking them trust questions and possibly falling into social desirability bias, right? And having maybe different responses from different regions, from different categories, socioeconomic categories or educational categories, and perhaps having different responses in relation to different branches of government. But if we actually launch a pilot study and offer this intervention to people, to a small group or relatively small group of people, we will see how many of them actually trust and take the intervention, enroll, and start saving. That would be my answer to trust, to avoid bringing in my personal bias, which is very high.
Thank you.
Thank you.
I think
Thank you for the question. It's a great question.
Well, it's a really important issue, isn't it? And I think you're right to suggest that behavior would be the proof of the pudding here. We have an interesting question from Jamie Edwards in the Q&A section. So again, keep bringing in these questions. So Jamie thanks you for these presentations and asks if you could say a bit more about existing policies for reducing child or household poverty. And how would a hypothetical child savings account policy link up with these? What would be the bond between existing policies and this policy?
Aytakin has much more contextual knowledge than I do, so probably you'll go first, and then I.
Yeah, I will. Okay, thank you very much for the question. How we define child poverty, right? If we're looking with a model like from multidimensional perspective, with child poverty includes access to education, like healthcare, nutrition, sanitation, protection from different kind of violence, which my colleagues we use at the Center for Social Development, or generally, if we look at from this perspective, child saving accounts are, as we mentioned, can be opened linked to post-secondary education to help children with achieving their education attainment, and with health, it can be opened for meeting health care needs. For instance, in Singapore, there is a MediSave accounts are open for every child, and assets are accumulated for assets. They are not necessarily child development accounts. There's child saving accounts, and a question also was raised about the accounts. So, for instance, in Singapore, they are saved for paying expenses of children, medical expenses of children. From that perspective, Singapore stands out, a good example how health dimension of child poverty it can be met. Another dimension, as I mentioned, for about existing policies that evaluated in the United States, there is a huge control trial is happening in the United States around child development accounts, which is called SEED Oklahoma. A lot of researchers papers are coming up from the data that shows that actually child development accounts help families to pay for post-secondary education in Oklahoma, where accounts are saved. And a lot of papers also, a couple papers also from that data show that child development accounts helps with mental health of parents, not only children. And we know how much child maltreatment and mental health is related in families when families have financial issues. It affects the relationship with children. From that perspective, we can shows that child saving accounts helps from that dimension as well. If we look at the child poverty from multidimensional perspective, there are evidences from countries like Singapore and Canada. Actually, I wanted to give these statistics also. Maybe Leyla, I don't know if you have read recent statistics from the Canada, that in Canada there is already a cohort which reached the child saving accounts, which already use their savings for education. It might answer also the question of James Edwards as well, how, saving accounts help with poverty. Again, if we're looking at poverty from multidimensional perspective, helping families to or owners to pay for their post-secondary education, it can play a role in reducing poverty from that perspective. I just want to read that statistic that in 2016, 50% of children in Canada had saving accounts. 36% of them were low to middle income families, which is like about 4 million children. And in 2015, about 2 million of these account owners has taken their money, withdrawn their money to cover their post-secondary educational expenses within Canada and overseas. So there is already, and it happened in 2015, probably there is an evaluation effect on different dimensions, Leyla, which you are interested, maybe on health, mental health, poverty. So this, I haven't read any recent evaluations from Canada, but there is a cohort already reached account grown for them, as we say, it is being used already. So you can look at the research to see how it affected their life as well.
In terms of, if I understood the question, how child savings accounts as a policy mechanism, how it relates to existing policies in Azerbaijan, my answer is probably most of the policies, if not all, in Azerbaijan are not universal. So there is a targeted social assistance program, and most of the payments are including payments related to children. For example, payments to mothers of children up to 3 years old. It's based on that, the targeted social assistance, or I believe also there's payment to caregivers in families with more than a certain number of children. I believe it's 5. The only universal policy, Aytakin mentioned that earlier, is the one-time birth payment, which is offered to families for at child's birth, and that's a one-time payment. And to the best of my knowledge, that's the only universal policy. The rest are either within the targeted social assistance program that is in place, it's been implemented, the infrastructure is already there, or it targets specific groups. For example, children with disabilities, they are in a different group. So we have a bit of I don't want to call it fragmented because I'm not a part of the system. So, but from the outside, it seems like we have different patches, right? So we have social targeted, in Azerbaijan. So there is a targeted social assistance program. There is a program for children with disabilities. There are programs for children of families of veterans who died at war. And so the bottom line is that most of them are not universal. Most of them are targeted, means-tested programs. I hope that if you have any additional question, I'm happy to discuss that. I don't know if that answers.
Yeah, I also didn't understand if the question was generally about child saving accounts in the world, how they are linked with reducing child poverty or Azerbaijan. In terms of Azerbaijan, Leyla started topic on Azerbaijan, in terms of universality of policies, we have a couple other policies which can be considered universal, such as universal daycare. Like kindergartens are universal in Azerbaijan. They're very small symbolic few. This is universal, everyone can use them. In addition, health policy. If we look at it, health policy is universal in Azerbaijan, and we have special детские поликлиники, like polyclinics for children. In addition to big hospitals, we have community-based, rayon-based polyclinics for children, and services by law is free of charge. But there is a second question about the quality and about the accessibility in terms of payments, right? This is the second question. So we are not talking about that. We're just talking availability of existing policies. So in addition to policies, which Leyla mentioned, one-time baby bonus, universal, but not automatic, there is health coverage, universal health coverage, and baby care, like daycare. And if schooling, of course, it is also universal and free. If it is considered provided by the government, it is also universal education policy-wise.
Thank you. I think that really covers the question, Jamie Edwards' question well. Thank you. Leyla, you have a question.
Yes, thank you very much for these fascinating presentations. It's very interesting and I learned a lot. But I was interested to know, Aytakin, for example, from your visit, as I understand, in 2017, 2018, and Leyla, your work, I don't know if you've directly worked on this in Azerbaijan or not, but is there any collaboration that's happening at the moment? Are you working with the government of Azerbaijan, or are you providing any consultancy, or would you be interested, or have you been contacted? Because it's interesting that there, so much work has been done and it's been spoken about, or, but I don't know if there is, are they benefiting from this, or is it difficult, or is there resistance?
I will go first. Actually, this policy paper was written as an answer to the request by Oil Fund of Azerbaijan. So when we were in Azerbaijan in 2018, we had an international conference. There was models of child development accounts were presented from different countries like Israel, Singapore, China, And next day we were invited by Oil Fund of Azerbaijan to meet with the head executive director. So head of the oil fund in Azerbaijan is the president, but there is also executive director who's managing administrative functions. So we met with the head of the oil fund of Azerbaijan, oil reserve fund of Azerbaijan. They were very excited about the idea. They asked us to put it down as a policy paper and sent to them. So we did that. But after that, we had a war in our country last year, and kind of war and pandemic came in. So our conversation, our discussions kind of stopped, but we will regenerate our conversation and discussion with them. And head of the oil fund is changed. He became the assistant to president right now. He's not in the oil fund. So all these kind of changes came in. So we will restart the dialogue conversation again with oil fund maybe, and also with maybe with relevant organizations. But really we had exciting interest from the oil fund of Azerbaijan. And this policy is a kind of answer to their request, policy paper.
Thank you for the question, Leyla. And Aytakin indeed is much more connected to the context. She also works with the heads. She also leads the social workers professional association there, right? So I would love to be a part of the conversation and policy design. Unfortunately, I've been much less lucky in my efforts to become a part of the conversation compared to Aytakin, but I would love to. And I might bring more of a critical voice, and not because I intend to criticize, because I'm a scholar and I do believe in empirical evidence beyond and above of everything. And I do believe that again, I'm going to say that each time when anybody has a wild idea of contacting me, that we do need to do a proper research in Azerbaijan prior to launching it, because we do need to understand answers to a range of questions. Why child savings accounts? Why not cash transfers? Why not fellowships? For example, if you want to improve the educational outcomes, offer the fellowships. What is the comparative cost of having child savings accounts? What's the total cost, and how does that cost compare to existing policies? And maybe instead of having child savings accounts, it's better just to increase, if we have money, let's just increase the payments to children, means tested payments to children, right? Maybe that. And I'm not saying this is the case. All I'm saying is there are questions that need to be answered. What is the saving behavior of our people? Will they trust these institutions? Will they indeed save? save? Do they have where to save from? And how all this, it's also, it's very important to keep in mind existing social norms and attitudes and behaviors in our people. It's very, very important to understand, not only will they trust institutions and which institutions they will trust, but also family dynamics. What is the relationship between a child and parents? And do parents see their child as a property? This is my child and I'm saving money, it's my money. Or do they truly believe that this money is for the child? All this, and I don't mean to undermine, our mental whatever, but I do believe that this is very important to keep in mind when implementing a seemingly wonderful policy in a specific context. Research is absolutely vital, but I don't know if how wild is this idea?
I just want to comment. I'm sorry, if we have time, I just want to comment. I missed saying two things during our presentation because I put selective parts as, like, if you read policy brief from the link, I can put in the chat if everyone interested. We have a big research component there. So we were not suggesting just go and open it, let's say, right away. We have huge, but because of time, I didn't talk about that component. Of course, you know that Dr. Sheridan is evidence-based applied scholar. He is having all these control trials in countries or in states, but where possible, to see effect of child development accounts. It is also part of our policy design. We, of course, and we will be happy to have, in this, include you in this conversation, of course. So what we are all trying to achieve well-being of children. And another comment I wanted to make, and probably I should make it when I start my conversation, should have made it, but I didn't. This isn't just one piece in achieving general child well-being, right? So when I said define the child well-being, I mentioned that there are a couple dimensions in child well-being, in child poverty, right? Education, health, mental health, child maltreatment, nutrition, access to water, sanitation, even like child labor. The child saving accounts, of course, we are not seeing it as something, that will come and solve all these issues you mentioned, Leyla, right? Family poverty. Here you talked about the family poverty. You talked about the social norms, right? And I don't want to have this idea that we're talking about the child well-being and child saving accounts as a kind of answer or intervention for all issues. No, it is just one piece related, highly possible, that can help with attainment of education and attainment of, that how education is valuable in Azerbaijan. Educated people might have different lifestyle, different life achievements, not always, but, it is still valued by Azerbaijani families. So in short, what I wanted to say that the country like Azerbaijan needs huge child well-being national policy, which has many, many interventions, evidence-based policies like child saving accounts to meet all dimensions of child well-being, to have improved child well-being. Child saving accounts, child development accounts is just one of the little aspects to help with achieving that goal.
Can I ask a question here about the policy itself? Surely research will tell us something about this, but it seems to me that the policy is only demonstrable over a reasonably long term. It's a policy that if it gets cancelled after 9 years or whatever it was in the UK case, it really never gets off the ground, in a sense. And it sounds like in Canada, Singapore, and some other jurisdictions, it's had time to actually produce cohorts of children with savings accounts who are now maturing and who are breaking into their piggy banks to buy education or what have you. Now, that's the future orientation sort of effect that was talked about. The concept that it would have that kind of psychological effect on the savers and on their families. But what about the politicians who commit to this policy? isn't there a danger that politicians are not going to be there in 5 or 6 or 7 years' time, or ministers are not going to be there in 5 or 6 or 7 years' time? I don't speak about presidents, but about the people who are running this policy. They may not be there in 5, 6, 7, 10 years' time, and the policy might evaporate somehow or other. Isn't this it's a great strength of this policy, but isn't it also a weakness? And I wonder what research tells us, if anything, about that.
I'll start, Aytakin, with your permission, and then I would love to hear your insight as well.
Of course.
So I want to comment on one thing. How demonstrable are these policies? Now, it depends on the specific outcomes that you're interested in. Some outcomes can be captured in a short time frame, right? For example, if you're interested, if you're interested in monitoring the saving behavior, that's pretty doable. Given that research design is in place and we're collecting data, and so it's pretty doable to understand in relatively short term, a year or two, what are savings behaviors of people? Are they saving? Do they trust? And so on. So, or if we are doing it. It depends also on the purpose. For example, if we're doing it with the purpose of if we're covering a specific, as a pilot test, for example, let's say, we're covering a specific population of children who are about to graduate from high school and go into the post-secondary school, right? So if we're targeting them again, that will allow us in a relatively short period of time, 1 or 2 years, to capture certain outcomes. Did they actually withdraw the money? How did they use this money? How much of that went to actually paying post-secondary education? It's also important to keep in mind that in Azerbaijan, we have this very interesting system where if you are performing well enough at the entrance test, then your education is free. So the costs of education are not necessarily costs of directly paying to an educational institution. The costs are, your lodging, your textbooks, your living costs. So this is also very interesting, and I would love to understand the family dynamic, how the financial decisions and are happening within the family dynamics, and are there differences in terms of saving and distribution of resources between children who are girls and children who are boys. It's a binary. In Azerbaijan, it would be pretty binary gender, right? So all these questions can actually be tackled in a relatively short time period. Maybe some other longer term outcomes, such as, okay, they saved the money, then they went to the college. What happened to them in comparison to cohort that didn't have this opportunity? Now, this kind of bigger, larger, more interesting, perhaps, questions indeed, as Professor Healy said, they indeed require a long-term monitoring and evaluation. Question about, I haven't done the research in terms of politics, the association between politicians and how politicians are responding to that, but I think one of the reasons why both Aytakin and I were smiling to this question is because the life expectancy of politicians in Azerbaijan is pretty high, so they don't change that frequently. So I think we have a
office expectancy.
Office expectancy. Thank you. Yeah, that's much more human. Yeah, thank you, Aytakin. You're right. So office expectancy are pretty high. So actually, this could actually serve us because then the politician
advantage.
This can be an advantage because then they will be able to see the hopefully positive results of introducing it. I don't know. I mean, I don't want to hypothesize at the moment.
Yeah. I just wanted to start with commenting about the office expectancy. I recently did a research in 6 countries, post-Soviet countries. I was measuring political will and commitment in investing child well-being. Actually, one of the things come up a lot in countries where offices changed a lot. child well-being people were complaining about it. They were complaining about it, that we train them, we work with them, and after 4 years they go, a new team come, has nothing, no idea, and our work interrupts. We have to do the work again. So, it's always, there are pros and cons for office expectancy as well. Some countries see it as advantage, some countries see it disadvantage. So there is always, this kind of discussion about it can play a positive role in some policies, especially for child well-being. You work with politicians, you educate them, you advocate for child rights, they are on board, and you continue with that. And another thing that after 2-3 years, they are gone, you have to restart the work again. Of course, it's gonna delay. I'm just hypothesizing. I don't know what research said about that. It might delay some policies. To your question, Dr. Dan, about the destiny of some policies, again, I'm not researcher in that field. I haven't looked at literature, but based on some examples from Azerbaijan or around in the region, some destiny of some policies even doesn't depend on internal politics. Sometimes it depends on outsiders as well. For instance, Azerbaijan had this universal monthly child allowance for every children. It's been there for many, many years. It was inherited from Soviet times. But in 2006, with the pressure of the outsiders in financial institutions, it was canceled. So since then, it canceled 2006, how many years now? We are advocating to get it back. It is not easy, right? So sometimes destiny of some policies, I wouldn't say it only depends on internal politics, also outsiders as well. And this is and it always it's always risk. In the United States, we had targeted TANF, targeted assistance for needy families. Before that, we had assistance for needy families. It was canceled by Clinton's administration, replaced with new one. So this kind of changes, modifications, cancellation of policy, I would say, depends on many, many factors, but not only internal politicians.
If I may add on that, so when Aytakin talks about external influences, if I understand it correctly, we're mostly talking about financial institutions, the World Bank, and those. And
I didn't want to call the names.
And there is a reason why they have a say, because we depend on them. Right. So so maybe one way to ensure continuity in our policies and full independence is to ensure the prosperity and development and well-being, so that we can make our own decisions, regardless of what some financial institutions think are good for the country. And again, I loved your question, Dr. Hill, about this continuity. I think continuity in policies is possible, and it is possible theoretically to achieve this continuity that would not depend on a personality of a policymaker. And for that, this is why I was talking about the social norms and social acceptance and acceptance by the constituency, right? So if we have a policy that fits into the general psyche of our society, if we have a policy that is widely accepted, it makes sense, it serves the purpose, and it's accepted not for the sake of a politician or a policy maker, but it's accepted by the entire society. I think that will definitely contribute to continuity. And again, thank you for the question. It was wonderful.
Well, thank you, both of you, for a really fascinating conversation about this really important issue, and a really interesting mechanism that I don't think a lot of people consider as a child development and a national development policy. So thank you for bringing this to our attention and explaining it in such great detail. We're at the end of our time today, and I just want to mention, first of all, after thanking Leyla and Aytakin for their wonderful presentations, and also thanking Leyla from the Oxford Nizami Ganjavi Centre for her support, I just want to say that next week, the final seminar in this series will be presented by another Leyla, Dr. Leyla Shaifuddinova of the University of St. Andrews, and she'll be speaking about the petroleum scape of Baku, past, present, and future. So you're all very welcome to join us next week. But thank you very much, Leyla and Aytakin, for these excellent papers.
Thank you for having us.
Really. Thank you for chairing our webinar today. I don't know if I said in the beginning that the webinar was recorded, will be recorded. I forgot. I think if I did, I'm sorry, but I'm saying it now, so it's on record. It was with the permission of everyone who is on the panel. But I wasn't sure that if I told our audience about it. Anyway.
Thank you for wonderful questions.
Thank you very much.
They're really thought-provoking, and I really deeply appreciate this opportunity to learn. Thank you very much.
Thank you. Okay.
Yeah, thank you very much for this opportunity. Bye.
Bye-bye.